Hello, future RTs. Thank you for joining again your daily RT. Today we're going to go over the second part of Applied Anatomy and Physiology. Okay, to begin with, let's see visceral control. Okay, we're going to talk about a little bit about the visceral control. So, the visceral control of the smooth muscle of the respiratory system is carried out by branches of the sympathetic and parasympathetic nervous system and chemical mediators transported to the lungs via the pulmonary circulation. Nerve fibers from the brainstem and spinal cord stimulate the smooth muscle of the bronchioles to cause bronchial dilation, this is what basically known by the sympathetic fibers. And the mucus glands produce mucus, which activates the parasympathetic. The blood vessels cause vasoconstriction, which activate the sympathetic nervous system. Okay, now the cranial nerve 10, which is also known as the vagus nerve, carries motor and sensory signals of the parasympathetic system throughout the airways and the lungs. This is known as the vagal innervations. Okay, so the lungs. Okay, a little bit about the lungs, which is important to know as an RT. I just created a few notes here. So, the lower lung volumes can lead to early airway closure, widespread alveolar collapse, which is known as atelectasis. Ventilation perfusion will be mismatched and result in hypoxemia. When you have a reduced lung volume by a high demand of oxygen, it will render the individual more susceptible to profound hypoxemia. In this situation, it will disturb the ventilation, lung volume, or the VQ mismatch. We're gonna talk a little bit about infants. So, especially in infants, they possess a remarkable ability to elevate their lung volume dynamically. Infants in distress can actively increase lung volume by trapping gas, improving VQ mismatch, and oxygen exchange. Infants also accomplish this by air trapping by using the diaphragm during exhalation, doing this by closing the vocal cords and narrowing the glottis. The narrowing of the glottis or larynx during exhalation is called laryngeal barking or grunting. Let's talk a little bit about it. So, what is grunting? Grunting is an expiratory sound caused by a sudden closure of the glottis during exhalation to maintain functional residual capacity, also known as the FRC, and prevent alveolar atelectasis because lung compliance is worse at very low or very high FRC. So, this is a picture. If you're looking down the epiglottis, you can see these are the vocal cords, the epiglottis. Thoracic cavity. The thoracic cavity is formed by the chest, upper back, and diaphragm tissues. The shape is a cone shape that protects the lungs, the heart, and the contents of the mediastinum. It is made of epithelial, connective, and muscle tissue. The purpose is to protect the vital organs within and can change shape to move air in and out of the lungs. The inner layer of the thoracic wall, in contrast with the lung, is lined with serous membrane called the parietal pleura. It is the opposite to another serous membrane called the visceral pleura, which covers the outer surface of the lungs. A thin fluid-filled pleural space forms between the parietal and the visceral pleura membranes, facilitating lung movement and avoiding friction. This is a picture of the thoracic cavity. As you can see, when the diaphragm contracts, it goes down. The external intercostals contract, and that's during inspiration, which causes an expansion of the ribs, which move the sternum upward and outward. But during expiration, the diaphragm relaxes, and the chest cavity and lungs contract. This causes the ribs and sternum to depress. In this case, the external intercostal relax, the internal intercostal and abdominals contract for active expiration only. Sternal angle. The sternal angle is also known as the angle of Louise, The sternal angle is an external marker of the point where the trachea divides into the left and the right main stem bronchi, which is known as the carina. The cartilaginous joint called the costal cartilage is on the lateral edge of the manubrium and sternal body and forms the attachment between the ribs and the sternum. This joint allows the ribcage to bend and permits the thorax to increase and decrease in size as we breathe. So this is a picture if you want to see how the manubrium, sternal angle, and the body looks, cipher process. Alright, thank you everybody for watching. Um, keep an eye on the third video coming up soon for the Apply Anatomy Physiology and Respiratory Care. If you have any questions, any doubts, please leave your comments in the section. Also, I would appreciate if you guys can like, subscribe, hit the bell so you can get notification of future videos, and hope to see you in the next video. Bye bye.